Hello, everyone, and welcome all of you on this session of colloquium. Myself, Dr. Nazia Nikhat, and with me will be Dr. Anjali Miglani, and we will be the moderators for this session. As you all know, the topic of the discussion for this session will be female diseases, case reports, and series. The session will be chaired by our dignitaries, Dr. Chandrani Hirat, who is medical officer in charge at Government Homeopathic Medical College, Velisara, Sri Lanka. Professor Dr. Anu Kapoor, who is principal in charge of Nehru Homeopathic Medical College and Hospital, and Dr. Kanchan Desarda, who is principal of Guru Mishri Homeopathic Medical College, Maharashtra. I welcome all of you on board. I think Dr. Chandrani Hirat is not here as of now, and hope she will be joining soon. So now let us begin with the session. All the participants are requested to be ready with their posters, and please stick to the time limit. You will be given 7 minutes for your presentation, and thereafter, after your presentation, you will be given opportunity to resolve any queries raised by the chair. So can we begin with the session? Our chairs, ma'am, can we?
Yes, dear. Please begin.
Okay, thank you. So the first abstract presentation will be by Dr. Pratibha Pathak. She is Associate Professor at Baxen's Homeopathic Medical College, and she will be presenting on the topic Homeopathic Management in Grade 4 Endometriosis and an evidence-based case report. Dr. Pratibha Pathak, over to you. Please go ahead.
Greetings, everyone. Myself, Dr. Pratibha Pathak, working as Associate Professor in Baxan Homeopathic Medical College in Surgery Department. So I hope I'm audible. So
Please
let me share. Just a second. Is my screen visible?
Yes, it's visible. You can zoom it a little bit.
Is it fine now?
Right.
Okay, so shall I begin now?
Yes, please.
Okay, so I would like to thank LMHI for providing me this opportunity and grand platform to present my case. I will try to be concise and to the point as per time limit concerns. So my case report is of grade 4 endometriosis. A brief about the disease first. So endometriosis is a progressive disease of reproductive age group females characterized by presence of endometrial tissue outside the uterus cavity associated with menorrhagia, metrorrhagia, infertility, pelvic pain. There is no definitive etiology apart from various hypotheses. It is indeed a debilitating disease that impacts quality of life and remains a significant cause of morbidity in females. In modern medicine, medical therapies include OCPs and other hormonal analogs, danazol, etc. But all these create a hormonal steady state that results in environment not conducive to the growth of endometriosis. But this prevents patient to conceive, as most of treatments are contraceptive therapies. On the other hand, surgical therapies may have long-term complications. In such scenario, a holistic treatment approach is needed, and homeopathy serves the purpose well as it treats sick individuals. So any kind of sickness is not beyond its sphere. It is matter of finding simillimum. Quickly coming to the case summary. Patient is 30-year-old female, is known case of endometriosis, which was diagnosed in 2017. Her previous CT scan report impression was of adherent both ovaries with posterior myometrium with a small cystic lesion in right ovary, along with formation of left tubo-ovarian complex, and likely endometriosis for diagnosis. She took all kinds of allopathic treatments without any relief. After her diagnostic laparotomy in April 2020, she kept on bleeding for continuous 8 months. Her life was completely disturbed and crippled. She left her job, her gymnastic practices. Then she was given Depo-Provera shots to stop the bleeding. And last shot was given in September 2020. Later, she was advised hysterectomy also, which she denied. She was also advised to go for psychiatric treatment for the depression and all. After that, she came for homeopathic treatment with complaints of heavy bleeding all the time, rectal bleeding, dyspareunia, severe abdominal pain, constipation, insomnia, depression, and chronic fatigue. She was asked to fill the endometriosis impact questionnaire at the baseline to assess improvement on symptoms level in future. So after detailed case totality evaluation and repertorization, pulsatilla 1 mg single dose was prescribed with placebo for 1 month. Please, you can refer to the repertorial sheet in the poster. There was episode of severe bleeding and pain after 1 month, and to combat that, hemamylase Q and MAC for 6S were also prescribed for acute relief as intercurrent medicines. Then there was phase of standstill condition around the 5th follow-up. So pulsatilla 10 mg single dose was prescribed with placebo. And in her latest follow-up on 1st November 2021, she reported that now her cycle is at 24 to 26 days interval, and she bleeds rarely in between periods. There is good quality sleep now. Pain is occasional but bearable. No rectal bleeding and no dyspareunia. She feels very optimistic, and even depression is not there. Her latest CT scan impression is of a bulky retroverted uterus. Right ovarian endometriotic cyst with adhesions are still there, likely endometriosis, but the left ovary is normal. So in 6 months treatment, there is good symptomatic improvement, and hence quality of life is also better as assessed by endometriosis impact questionnaire. So in my opinion, such cases can be managed by homeopathy. As we see, progress of disease is very, very slow, and
we are
no
not
organ
able
damage.
to see the lower part. Please move your screen.
Yes, definitely.
The number of what? Number of atoms that make up a molecule in a molecule.
Shall I continue? Can you see it now?
Yes.
Okay, so in my opinion, such cases can be managed by homeopathy, as we see progress of disease is very, very slow, and no organ damage is also seen, which holds promising in opinion of gynecologists as well. Treatment is still continuing, and my expected outcome is conception of female in this case, of course, after further improvement at a pathological level also, so thereby treating the infertility as well. So this was my case. So you can see homeopathy is working nicely in giving her symptomatic relief and improving the quality of life as well. So thank you, everyone. I would welcome the questions if any.
Ma'am, Dr. Anu Kapoor, Dr. Kanchan Desarda, if you have any questions, please go ahead.
Yeah, just one question, Pratibha. Did you get any lab investigations done for your case?
Yes, ma'am. I had gone through the CT scan. Reports are there in the poster.
Did you go in for the CA-125?
Yes, ma'am. CA-125 was negative, was found negative, and other investigation.
CA-125?
Sorry?
What was the range of CA-125?
Ma'am, it was in the normal limits. I don't recall exact range, but it was in the normal limit. I recall that. Otherwise, I would have put in there.
Yeah, but it's a small advice from my side that if you continuously monitor her CA-125, that will also give you a very prognostic review of your case. Huh?
Definitely, ma'am. I'll take it into consideration. I'll regular monitor.
That is a very sensitive test, and because the ovary is also showing some adhesions, so I would suggest.
So it can grow cancerous in future. Yeah. Yes, ma'am. That I will take it into consideration. Thank you so much for this.
Good.
Thank you so much.
Any other questions, ma'am? Okay. Thank you very much, Dr. Pratibha Pathak. And next in the row, we have Dr. Anju Jethani from India. She is Chief Medical Officer at Department of Ayush, Government of NCT of Delhi. Over to you, ma'am. Please go ahead with your presentation. Dr. Anju Jethani.
Hello.
Yes,
Yeah, I'm audible?
Yes, ma'am.
Yeah, I'm sharing my screen. Is it visible now? Is my screen visible?
It is visible.
Yeah, okay. Respected chairs and the dignitaries present today, good morning to all. I'm here to present a case report on multiple uterine leiomyomas treated with individualized homeopathic medicine. Leiomyomas, as we all know, they are the benign tumors of the uterine smooth muscle and extracellular matrix, and are extremely common in the common medical condition of the reproductive tract during the reproductive age. But there are few non-surgical treatment options available. Without going into the detail of the etiopathogenesis of leiomyoma, I would like to draw your attention to few important points which are relevant to my case presentation. Leiomyomas have abundance of fibrotic tissue, hence they are known as fibroids. Leiomyoma cells, they secrete abundant amount of collagen fibrils, and therefore they are resistant to non-surgical treatments, which are options which are available as from the point of view of allopathic treatment. So the surgical treatment methods, they have become a mainstay for the treatment of leiomyomas. And the options available are hysterectomy, myomectomy, uterine artery embolization, and radiofrequency ablation. And in fact, the fibroid has been the most common indication for hysterectomy in females. But these all procedures have their own complications, and they also involve higher medical expenses. Therefore, this in turn brings our focus to homeopathy in the treatment of leiomyomas as a cost-effective and viable mode of medical management. With this background, I would like to come to my case now. This was a case of a 39-year-old female who presented with menorrhagia of a period of duration of 1 year. The patient used to have early cycles, and the character of the flow was dark and clotted, accompanied by dysmenorrhea with pain in right iliac region. She also complained of premenstrual right-sided headaches and stiffness in her lower back with contracted sensation. This headache and backache were worse by cold air and better by warm. The patient also, due to repeated loss of blood, she complained of mild palpitation and dyspnea on exertion. She was chilly and had desire for salty food. On examination, there was tenderness in right iliac region and mild pallor. As a diagnostic tool, ultrasound scan was done, which revealed multiple uterine, intramural, and subserosal myomas with cystic loculated collection at right adnexa, likely to be hydrosalpinx, as can be seen in the ultrasound scan displayed in the poster. Further, the patient had reported to me after taking few homeopathic specifics from another physician, but there was no much clinical improvement. Keeping in mind the paucity of any significant characteristic physical symptoms available to guide me in the selection of the remedy, I thought of exploring it. So the evolutionary analysis of the case was explored through case analysis. In this regard, the patient narrated an event which happened in her office. There was a colleague of the patient in the office who was humiliated wrongly by her supervisor. But this colleague could not raise her voice against this injustice, and the patient, being strong-willed and could not tolerate this, so she fought for her colleague, and she expressed her anger against this supervisor. After this event, she had her first episode of menorrhagia, and on further inquiry, it was confirmed that the patient was quarrelsome and she was sensitive to injustice, could not take it. And her sympathetic attitude, and together with her desire to fight for injustice, gave me the first clue to think of the homeopathic medicine causticum. Further, that there was right-sidedness, chilliness, and desire for salty food, and the symptoms taken on repertorization were willpower strong, injustice cannot support, and abrupt. And in this, with this, the right-sidedness, chilliness, and desire for salty food corroborated the choice of the homeopathic medicine. So the patient was prescribed causticum 200 in unit dose, and causticum was repeated at suitable intervals when required. The follow-up was done after every menstrual cycle, and the symptoms were assessed on the basis of the Oridal scale. Just to give you a brief idea of the Oridal scale, it is the short form of the outcome in relation to impact on daily life. This scale has been designed to be patient-oriented, and it allows the patient to assess their outcome objectively on a scale ranging from +4, which means cured, and to -4, which means major deterioration. And in addition to these, repeated ultrasound scans were done. After a period of the treatment went on for 8 months, and the symptoms gradually improved. After a period of 8 months, the patient's menstrual symptoms had regressed, had resolved, and there was complete regression of multiple uterine leiomyomas and cystic mass, as is evidenced by the ultrasound scan attached, displayed in the poster. To conclude, this case study highlights the effectiveness of individualized homeopathic treatment in leiomyomas, and it also emphasizes the importance of anamnesis in selection of remedy. It also brings forth the need to conduct further randomized controlled trials to establish the effectiveness of homeopathic as a treatment option for leiomyomas. Thank you for your patient hearing.
Thank you, Dr. Anju Jithani. Any questions from the chair? Ma'am, do we have any question for her? Okay. We'll move ahead. Next in the row, we have Dr. Syed Mohammad Bhai. He is consultant at Dr. M.L. Dhavle Memorial Trust, and he will be discussing on the topic exploring role of homeopathic management in labor cases in a rural setup, a case report. So please go ahead.
Yeah, good morning. Yes, I am sharing my poster. Is it visible?
So please zoom it.
Yeah.
Yes, it is visible.
Yeah, good morning. Good morning to everyone. I am presenting the important aspect of homeopathic management in the labor cases in the rural setup. This experience generated in the 3 years of the project in the rural setup for the mother and child care programs. That times we initially start with the ANC care, and a lot of deliveries we conducted in the hospital. So initially we focus that the delivery comes and we inform to gynecologist, and gynecologist prescribe the allopathic mode of treatment. So gradually we understood that there is it is a physiological process. So sometimes it did not require the allopathic mode of interventions. When we understood there is a functional disturbance and there is a certain hormonal and neurological processes get hampered, and it blocking the process of delivery, that is blocking the process of delivery. So we gradually overcome that, and we observe the lot of cases in the labor ward and the female ward, and we construct the certain information and totalities, and then we started prescribing the homeopathic remedies, and we found the best result. So initially we use the partograms for the understanding the where is the block, how it is the labor is progressing, where it is diverting to the danger lines, where we took the actions, what is the condition of the baby, what is the condition of mother, that we understood and find out the where is the block. And then if the block in the functional zone, we intervene the remedies, and we found the result. So there is a 33 cases we use the homeopathy medicine, and we found the beautiful result in conduction of deliveries. Among that, I have selected 2 cases in which the first case we handle with the using the pulsatilla, and we found there is a delivery occur in the rapid way. So in the first level, we found the we prescribed the remedy, and it precipitate the labor process, and labor occur within a short period and conducted normally without any problem in baby and mother also. And we delivered the 2.6 healthy baby. In second case, we found there is a primary gravida where we prescribed the coliform. Here we use the repeated dose because of there is a problem in the cervix. Because we found in the examination there is the cervix is very thick and rigid. It's not allowed the further progress of labor. Then we construct the totality and we found the beautiful result after prescribing 2 doses of coliform, and the delivered a 2.26 kg healthy baby. So these are the 2 cases, and other cases in which we found the pulsatilla is the common remedy. In the 16 cases, we found the use of pulsatilla, which helps in the process of delivery process. Coliform also indicated remedy in 7 cases, and where also we found a beautiful result. Calicaraca, chamomilla in 1 case, and sickle cord in 1 case. So in this different spectrum of remedies, we found the result. So this process we understood important things is the observation in the ward. So how it is a labor is the stressful and major event in the woman's life, and the response to that labor is the individualistic. Every woman react to that labor in a different way. So we understood how the this lady is reacting to this labor. So we need to understand the reactivity and sensitivity and susceptibility of the each lady, the how she is throwing the symptoms. So in the painful situation, she is not able to give the all the data. So observation is very important. So in the pulsatilla, important observation I found desire to sit, or sometimes desire to walk slowly in open air. So this is the purely observation symptoms. So desired fanning, these are the observe how the patient is behaving in the ward. Then other symptoms we can ask a little bit in the physical level or in the mental level, and we construct the totality and come to the remedy. Similarly, we found the coliform also. So coliform have important thick cervix, especially the anterior leaf. And there is a typical irregular contractions, because in the block we found the atonicity of uterus, and it produces the irregular and infrequent contraction. So this blocking the delivery process. So this is the important feature. Other features are available in the screen. In the Kalika, we found another important part is the pain with abdomen pain with the backache. And important mental level, the patient is try to cling or hold the relative's hand or doctor's hand. That indicate the she want company, or she wants somebody near to during pain. So that is the important mental symptoms. So that allows the selection of proper remedies. And definitely susceptibility, sensitivity, and reactivity helps to understand what is the potency and possibility. Where there is a lot of reactivity, symptoms is very high, and the clear-cut totality is available, we prescribe the higher potency in minimum doses. And where there is a symptoms is less, reactivity is less, where we found there is a susceptibility is very low or moderate level, where we prescribe the lower potency in multiple doses. So this helps to understand the process of delivery things. This is an important learning where we can understand the diagnosis and obstacles is the key factor in the management of labor. Skills of observation are the important part, and the understanding susceptibility, sensitivity, and reactivity to selection of the potency. So in short, this is my presentations. So now, anybody want to ask questions?
Thank you, Dr. Mohammed Bhai. Ma'am,
Yeah,
do we have any question for him?
Now, Dr. Syed is a very good presentation, and so many cases in short time, explain so many remedy. So good.
Thank you. Thank you very much, madam.
Dr. Sayed, very good. I just want to ask you one thing, whether these labor cases were, from what time were they followed? The follow-up existed right from the antenatal setup, or they were looked after only during labor? That I couldn't get.
Yeah. Important part is we can see that patient since when they register in the hospitals, means ANC care we understood in the proper way.
Okay.
And initially, since the ANC care and then delivery process. So it is a continuous process of handling antenatal and the delivery process. When we understood the any problem in the ANC itself, when there is a short pelvis or any obstruction growth in the passage of the labor things, then we will according to that we modify the management strategy. So ANC process and then delivery.
All the mentals and all the drug picture, the patient picture was with you when the patient came to you for labor, right?
Yeah.
The entire history was with you?
Sorry, madam?
You had the entire history with you when you were doing the labor?
Sometime in the ANC period, we define the case in the proper way, in the evolutionary way. Then we sometimes have the constitutional memory with us, or sometimes if patient is not defined, then in the during the labor process we collect the data in the short way, because it is a short times and we deliver the result in shorter period. So we have to understand the totality in faster way and prescribe the remedy. So sometimes available, sometimes not available.
Good. Okay.
Thank you, madam.
Thank you.
Thank you, Dr. Sayed.
Thank you very much.
As we have been told, Dr. Chandrani will not be joining us. So next in the row we have Dr. Amuda M. He is medical officer at GHD Kizalur, and he will be presenting on homeopathic treatment in infertility due to bilateral ovarian endometriosis, in which laparotomy, IVF, or LCSI attempted with donor ovum failed. A case study. Dr. Amuda?
Ma'am, is it seen, ma'am?
Yes, it is visible.
Can I start, ma'am?
Yes,
Homeopathic treatment in infertility due to bilateral ovarian endometriosis in which Am I?
You are audible. Please go ahead, ma'am.
Ma'am, audible, ma'am?
Yes, you are.
Okay, ma'am. In which laparotomy IVF for its attempted with the donor ovum, a case study. Introduction: endometriosis is the most mysterious causes of female infertility. It is more common in their age groups 30s and 40s. Endometriosis is characterized by the presence of endometrial tissue outside the uterine cavity and associated with chronic pelvic pain and infertility. And mostly the endometriosis presenting with three characteristic features: dysmenorrhea, dyspareunia, and infertility. In here the cases in bilateral ovarian endometriosis. The treatment of choices for endometriosis is the modern medicine is the only the laparoscopy or laparotomy, and following laparoscopy or laparotomy, IVF or ICSI with the donor ovum. And even though the treatment is said to be available, the percentage of result is very low and it is highly expensive, and hence it is not affordable to the people of low socioeconomic status. Here the patient is also concerning with the low socioeconomic status. And even though he is in the low socioeconomic status, she is gone for laparoscopy and the 2 ICSI and 2 IVF with the donor ovum. And even though it has been done with the donor ovum, the IVF and ICSI was failed. Recurrence of additions and endometrial recurrence of additions and emotional instability to the acceptance of the donor ovum is the major issue. Endometrial encountering during the treatment because of the lack of genetic link with the offsprings. Homeopathy could be safe and cost-effective treatment for this such type of patients. And purpose, the aim to provide cost-effective treatment for patients suffering from infertility due to bilateral ovarian endometriosis, and to examine the effectiveness of homeopathic medicines in infertility due to bilateral ovarian endometriosis in which laparotomy and IVF or ICSI attempted with the donor ovum, and to provide conception with her own ovum. An objective to manage primary infertility by enhancing the oogenesis by using the homeopathic medicines. And methods design is a single case study and sample a case diagnosed as infertility due to bilateral ovarian endometriosis in which laparotomy or IVF or ICSI with attempted with the donor ovum. And tools, case records, and laparotomy reports and ultrasonogram reports, and technique, homeopathically indicated medicines were administered to the participant. Period of study from 26/9/2014 up to conception. Cases evaluated on monthly basis. USG done data collection, homeopathic treatment at Janani, Government Home Hospital, Kannur. And here the result, after within, I think it's within 3.5 months, the patient delivered, the patient conceived. And the medicines are prescribed according to the totality of the symptoms, pulsatile 200 and pulsatile hypotension and hemamelis tinctures and potencies were used. And after for one conclusion, infertility due to bilateral ovarian endometriosis can be effectively managed by homeopathic medicines. IVF for ICSI with the donor, failed cases can be effectively managed by homeopathic medicines. Homeopathic medicines can bring normal ovulation, and homeopathic medicines can be used to induce oogenesis. Participant can conceive with their own genetic link, hence solving huge mental trauma to the mother. Recurrence of bilateral endometriosis even after laparotomy can be effectively managed by homeopathic medicine. Even hormonal therapy after effect of hormonal therapy can be solved. Limitation, since it was a single case, it cannot be generalized, and the scope of further research should be replicated with large sample size. And here are the references. Thank you, ma'am.
Thank you, Dr. Amuda.
Thank you, ma'am.
Ma'am, do we have any questions for her? Dr. Anu Kapoor and Dr. Kanchan Desarda. Ma'am, do we have any questions?
We can
How
continue.
many cases treated, Amuda madam? How many cases you treated infertility?
Oh, treated many cases, ma'am. I have taken one cases. It's because it shows only 3.5 months for the conception, ma'am. I have given pulsatile 200, and the following the pulsatile, the high potencies were given. I have so many cases of endometriosis and adenomyosis cases, ma'am, with positive results. Here I have taken a single case study.
How many percentage result you got?
Ma'am, pardon, ma'am?
How many percentage result you got?
Percentage, ma'am.
Yes.
Okay, ma'am. Regarding endometriosis, it is after 35 years, it is very difficult to conceive, actually. With a lady with the endometriosis, it's very difficult to conceive. In that case, we have regarding the percentage, I think it's about above 70% we have got results, ma'am. Here again, IVF and ICSI with the donor patient has not has got a she didn't get a normal ovulation, and she don't get a normal ovum and a healthy and a mature ovum, so that she prefers a donor ovum. And even after the donor IVF ICSI with the donor ovum, she has not conceived. So she came with our OP with a great desperation. And homeopathy can help her, ma'am. Now she is having 2 children, ma'am.
Any other question, ma'am? Okay. Thank you, Dr. Amuda.
Oh, thank you, ma'am.
Next, we have Dr. Rama Kamsali. She is the Chief Medical Officer at Department of Ayush, Government of NCT of Delhi, and she will be presenting on a case of dermoid cyst of ovary.
Good morning, all.
Yes.
Good morning.
I'm presenting a case of dermoid cyst of ovary. This is a case of dermoid cyst of ovary treated homeopathically. Dermoid cysts are a type of germ cell tumors, also called as teratomas, arises from germ cell material that grows all three layers of tissues found in the body. Therefore, these cysts can contain material such as hair, skin, sweat glands, fat, bone, nails, teeth, cartilage, and in rare occasions, thyroid tissue, usually develop in women in their childbearing years during their active reproductive life. These tumors are bilateral in 10% of the cases. Squamous epithelium lines the walls of the cyst.
Can you present your PPT? Screen share.
I have shared my screen. Is it not visible, ma'am? Dermoid cysts are the type of germ cell tumors, also called as teratomas, arises from the germ cell material that grows all three layers of tissues found in the body. Therefore, these cysts can contain material such as hair, skin, sweat glands, fat, bone, nails, teeth, cartilage, and in rare occasions, thyroid tissue. Usually develop in women in the childbearing years during their active reproductive life. These tumors are bilateral in 10% of cases. Usually cysts are lined by the squamous epithelium. There is a raised protuberance in projecting into the cyst cavity known as Rokitansky nodules. Ovarian dermoid tend to be asymptomatic, but symptoms do exist, especially when the cyst has become large in size. They can cause abdominal pain, abnormal menstrual bleeding, dyspareunia, low backache, dysuria, nausea, vomiting, pressure in the pelvic region, weight gain, etc. Large dermoid cysts sometimes cause torsion, rupture. They may rupture spontaneously, leading to surgical emergency. CA-125 may be detected in the serum of up to 86% of patients with ovarian neoplasms. With higher levels of serum 125 being considered suspicious for malignancy. Normal levels are usually 35 units per milliliters. Treatment depends upon the age of the patient and signs and symptoms. Conventionally, large dermoid cyst and with raised CA-125 levels are indication for surgery. Regarding case, if a 40 years female came to me with abnormal menstrual bleeding was persisted 8 to 10 days in every 3 weeks with secondary dysmenorrhea, pain in left leg for the past 6 months. Ultrasound report suggesting of left-sided ovarian cyst with abnormal CA-120 levels that was 93.7. With increase in size and volume of left ovary, she was advised for surgery since there was no response with a conventional treatment. She has gone all allopathic treatment and 2-3 gynecologists referred her for surgery. She has taken homeopathic too before coming to me. A patient hails from middle class family, a very dominating. Here I am presenting only the constitutional totality because of time and space limitation. She was very dominating lady, rarely trusts anyone, suspects everything. She cannot tolerate tight clothing and unable to tolerate warmth. Before 6 months, her cycles were regular with moderate flow and moderate duration. She has been treated successfully with homeopathic medicine lacasis based on her constitution totality of the symptoms and with Tuja as an intercurrent medicine. Patient was cured successfully and confirmed serologically and radiologically with CA-125 levels in ultrasound reports repeated. Here the repertorial totality. Dictatorial, I have used complete repertory. Dictatorial, suspicious, clothing loosening amelioration, tumor, ovarian left-sided, menses protracted, prolonged, menses painful. This is secondary dysmenorrhea symptoms. Here are the reports. Ultrasound report on 14 August 2015, there was a left ovarian cyst. Doctors advised her for CA-125 and pap smear. Pap smear was normal, but CA-125 was abnormal. CA-125 levels in 28th March was 93.7. And 15th December, ultrasound report was left ovarian cyst with size 46, 43, 44, volume 46 cc. There was impression of left dermoid cyst. She came to me on 6th April with left-sided ovarian, all with the CA-125 ultrasound reports. Since she has taken already homeopathy treatment somewhere else, reports were not available. She was not aware of the treatment, and she was at that time not cooperative, and she was not ready to reveal her complete history. Based on her past history of recurrent UTI, I gave her Toja 200, 3 doses, and SL for 2 weeks. After 2 weeks, she came with, she said that there was no improvement in her complaints, but she wants to continue. And I had taken her complete history, and she was cooperative and revealed all her past history and family history. She had a pair of 4, 2 live children. First child was normal delivery, but she was RH negative. She was not aware of her negative blood group. And second child was stillborn because of erythroblastosis fetalis. And third child was given some injection during her 6th month of pregnancy. She was unaware of that. And fourth one was unwanted pregnancy. Based on her all the history and presenting complaints totality, I gave her Laxis 200, 2 doses with placebo. After that, her cycle was, she said there was little improvement, not much, and her recurrent UTI was again, she has complained of UTI. Then I gave her Toja 200 on 12th July and followed by SL. But after that also there was not much improvement. Based on her totality, higher the constitution, higher the potency, I gave her Laxis 1M on 30th August. After this, she felt much improvement in her cycles, flow, duration, everything.
Ma'am, please quickly wind up your presentation.
Yes, these are the CA-125 reports. These are 28th March 93.7 and 29th 11 16.6. And ultrasound report, this on August 14th, cyst size was this much, and December it was like this, and 29th November cyst become normal. Now normal size, it was functional cyst. Here I'll show the reports. Ultrasound reports before treatment and after treatment, and CA-125 reports before treatment and after treatment. Here I conclude that this case has been successfully treated with homeopathic and saved the patient from surgery. And it was suspected malignancy because of higher levels of CA-125 and increased size, and even the age of the patient 40 plus.
Thank you, Dr. Rama. Ma'am, do we have any questions?
Let's continue.
Okay. From the next presentation onwards, Dr. Anjali will take over the moderation.
Thank you, Dr. Nazia. Our next speaker for the day is Dr. Chetna V. Satpal. She is a student studying at Dr. M.L. Dhavle Memorial Hospital, Maharashtra, India. She'll be talking about comparing the rubric representation of menstrual complaints from Kent's repertory and Minton's uterine therapeutics through clinical cases. It is a retrospective case series. You are welcome to present.
Hello. Am I audible?
Yes, please.
Is my screen sharing on? Hello.
Yes, it's fine.
Very good morning to all. I am Dr. Chetna Vijay Satpal, student of Repertory Department from M.L. Dhavle Institute of Palghar, Maharashtra. And my today's topic of presentation is comparing the rubric representation of menstrual complaints from the Kent's repertory and maintenance uterine therapeutics through the clinical cases, and it is a retrospective case series study. As we all know, menstruation is a normal physiological process in woman's life, and it should not disturb the harmony of an individual like any other physiological processes. A woman usually remains unbothered until and unless those 5 days start troubling her, when they become painful or extend their stay in her life or comes whenever they want. That is the commonest problem, which is more frequently observed, are dysmenorrhea and other menstrual irregularities. Being a female, I was already interested in the field of gynecology since the beginning of my medical education. And as a student of repertory, we all very versed with the extensive work done by Dr. Kane and Dr. Minton in the field of gynecology. Kane's repertory, being a general repertory, is used abundantly even in the today's era. But at the same time, we should not forget that the utility of regional repertory, that is, Minton's uterine therapeutics, is used in this study for the complaints of for menstrual related complaints, and the comparative study between the two was carried out to understand the utility of both the repertories. So this is the retrospective case series study, and sample size was 70, selected using simple random sampling. The cases were selected where action result complex was already established, classification of symptom was done, and each case was repertorized using Kane's repertory and Minton's uterine therapeutics simultaneously. And the qualitative comparison between the two was carried out, and also on the quantitative data, statistical test, that is chi-square test, was used. Um, to find the utility of both the repertory was the main objective of the study. And as we can see from this graph, it is observed that Kane repertory covers more menstrual-related rubrics in the 24 cases, and Minton's uterine therapeutics has covered more menstrual-related rubrics in 12 cases. And where both the repertories have covered equal number of rubrics, that is 34 cases, the qualitative comparison was carried out. And in that, we find out that Kane's repertory was more useful in the cases of dysmenorrhea and menstrual irregularities such as DUB and oligomenorrhea. And it is more useful as it has larger set of concomitants, modalities, and associated complaints as compared to Minton's uterine therapeutics. And Minton's uterine therapeutics was useful in the complaints of menorrhagia and menometrorrhagia. And having less number of remedies was one of the important plus point of this repertory. Remedy wise, we can see that Kalikap, Cilicia, Sepia, and Sabina, Clapsy, Bursa pasteuris are more useful in the maximum number of cases of menstrual complaints. So at the end, I would like to conclude that it is obvious and evident from the study that Kane repertory has covered more menstruated rubrics as compared to Minton's uterine therapeutics. But I would like to encourage the physician to use Minton's uterine therapeutics in OPD and even at the bedside, especially in the cases of menorrhagia and menometrorrhagia. Thank you all for listening. That's it, ma'am.
Ma'am, any questions from her? Dr. Anu, ma'am, Dr. Kanchan, sir, ma'am, any questions, please?
No, it's okay. We can proceed.
Thank you, ma'am.
The next speaker is Dr. Manpreet Kaur. She will be talking about the descriptive case series study for understanding the skills, attitude, and knowledge required in case taking in cases of PCOS. And she is pursuing her MD from ML Davle Institute, Palghar, Maharashtra.
So Dr. Hanneman in his medical observer, he states about the three qualities that a physician should possess, that is perceiving accurately, that is the knowledge. So in his aphorism 3 in Organon of Medicine, the 6th edition, he states about how the physician should possess the knowledges in the various things in order to restore the health. Second thing is the careful observation, which is altogether another skill which is possessed by the physicians. And the third is the coolness, calmness, and firmness of the judgment, that is the attitude of the physician. Likewise, if you see in the Organon of Medicine, 6th edition, aphorism 83, also states about the case taking, that is the quality of the physician, that is, physicians should possess attention in the observing, sound senses, and unprejudiced. So if you see on the similar platform, even the modern medicine states about these three concepts, that is about the attitude, knowledge, and skills. So talking about which was published by Dr. Benjamin Bloom in his Bloom's taxonomy, which states about the three concepts, that is cognitive domain, talking about the knowledge, which is the intellectual capability. Second is the affective domain, which talks about the attitude, that is the feeling and emotion and the behavior. Third is the psychomotor domain, that is the skills, which is the physical skills which a physician should possess. So taking these two planes or taking these two things on the one plane, so we talk about Dr. Hahnemann, who has stated about all these things with the help of this study. So while doing this study, we require two tools. With that is first is CSEF, that is Clinical Session Evaluation Form. So this tool is basically which helps us to convert the subjective observation into objective measurable observation. So basically this tool is filled after the case taking. So this case taking is done in the PCOS cases, and this is filled by the physician as well as the observer. So talking about the tool, it contains the mainly following headings, that is history evaluation. So this history evaluation, basically the history which is written by the patient before the case taking about himself. Second is the interview, like how we are planning with the interview and what happened after the interview. Third is the problem formulation and the resolution. What resolution and the problem did the physician give to the patient? Then it is the doctor patient relationship, or what level did the relationship was formed, that is whether friend, physician, or a guide is. Then talking about the other thing is like the physician's knowledge. So knowledge was judged on the basis of the general knowledge as well as the specific knowledge. So general knowledge can be pertaining to anything around in society, and the other is the specific knowledge, that is with regards to the disease. Then it is the sensitivity and the sensibility. So the sensitivity and the sensibility is basically the how did the rapport formation take place, and in what level or what base did the physician was sensitive with the patient, like the vibration of the patient. Then the skills, what skills were utilized during the case taking, and what level of judgment did the physician do along with the blocks where the physician got blocked during the case taking. So second thing is CAST checklist. This checklist was basically self-structure checklist, which was filled after the interview with the help of the CSA filled after the interview. So this CAST checklist had following components of knowledges. That is the differential knowledges, causative factor, sign, symptom, investigation, resolution of disease, person, and the conflict, and the person diagnosis, along with the knowledges of general and specific knowledges. So talking about the components of attitude were greeting, orientation, acknowledgement of the history form which was filled by the patient, receiving the life space, sensitivity, sensibility, and was a rapport form. Then the skills were the following skill: questioning, exploring, listening, observation, blocking, guiding, assurance, and confrontation, counseling, etc. So if you see, as said by Dr. Elizabeth, a well-taken case is half cured. So in order to see the competence of the physician, this study was done to evaluate the physician at to what level is his knowledge, skills, and attitude used in the cases of PCOS. So my main objective of this study was to understand the knowledge, skills, and attitude required in the cases of PCOS. So talking about the methodology of the cases, there were 30 cases in this study. So this is basically an observational prospective study, and these PCOS cases were taken with the help of the simple random sampling. And the inclusion criteria, which included all the females of the reproductive age group who were menstruating, and it was diagnosed with the basis of the rotundum criteria. And the tools which was required, as said earlier, is the CSCF tool and the CAST tool, along with the standardized case record of the institute. Then total 12 physicians were involved in this study. And if you see, there was test which was applied in this, that is the Man-Whitney U test. So talking about the observation of the cases, it was like with the help of the in-depth interview, we could identify two groups for that. That is group A, which include the core conflict, where the physician could actually identify the conflict of the patient, which led to the diseases, and the other group was the non-core conflict group, wherein 16 patients were 14 patients were in the non-core conflict. So if you see, after applying the test in the heading of knowledge, attitude, and skills, we could see there was a significant difference between the two groups. That is, the knowledge and skills attitude used in the group A, that is the core conflict group, were quite significant whereas the knowledge, skill, attitude used in the group B, that is the non-core identified group. So if you see, uh, hmm, talking About the conclusion is like, if we see the knowledges were assessed at the level of clinical, general and homeopathy. So the clinical knowledge included the signs and symptoms, investigation and the differential knowledge, which helped the physician to identify and to differentiate between the differential diagnosis of the other various endocrine. For example, we have cases who had DM along with the primary and secondary infertility as well. Talking about the general knowledge includes man in the environment along with the nature versus nurture, how the society has the impact Talking about the attitude, so the attitude of the physician in majority of the cases were of rapport formation. So once the rapport was formed, the physician could identify the core conflict of the patient, which which help us to the come to the remedy as well as give the resolution to the patient to deal with such cases. Then coming like how did this help? How did the rapport help the physician to form this? So that was with the help of the greeting. So like greeting and orientation were the main thing. If you see in the attitude section of the observation, if you see greeting, acknowledgement of history form and the rapport formation is more significant in the group A. So with the help of these three things, we could identify the code. Talking about the higher skills. So skills, if you see exploring role forming, role playing, empathizing, silence and guiding were used. So with the help of exploring, one could come to the conflicts of the group. Then what role did the physician play during the interview was also seen. And empathizing and silence was two skills which were used markedly. That is, in such cases where it happened, physician had to keep maintain silence so that the patient could speak up with their whatever inner turmoil is going on to them. And if you see the higher skills such as blocking and confrontation were not majorly used. So this blocking and confrontation is basically comes with the practice, which is usually not seen in these cases because the physician are not that competent enough to handle the cases of PCOS here. So thus the CAR scale, that is the checklist which we have formed, help us in understanding the person and identifying the inner core conflict so as to manage the case with the help of the core so that we can give the resolution and the remedial measures. So talking about the limitation of my study was like this CSF and CAR scale needs global validation. And other thing is like we just had a small sample size of the physician that was which is 12. So for the further study, I would request that we should at least have a larger number of sample size of the physician. And a third thing is like the raw sensitive the physician in this retrospective case. Like if I want to take a case of PCOS and find what were the knowledge, skills, attitude used by the physician in that case, so that is not that possible as if we do the prospective studies because we don't know that what time did that physician go through during that case taking or what knowledge skills he used with respective of the case record which we have. Still there is discrepancy in the data. Hence, this is a limitation of my study as well. Thank you. Thank you.
Thank you, Dr. Tripti. Any questions from the chairs or from any panelists, please?
Yes, you are start. Trupti, you can start.
This is a prospective observational clinical trial to evaluate response to support in management of PCOS. So we all know that PCOS is an emerging lifestyle disorder, and this is basically due to our modern lifestyle. Apart from the genetic predisposition and the modern lifestyle, there are different factors which are affecting PCOS. So the common factors which can affect PCOS are in association with the thyroid disorder, hyperprolactinemia, adrenal pathologies, or any ovarian tumors. The Rotterdam's criteria is the one which is commonly used, and this criteria is widely used universally to diagnose PCOS. We have different clinical features of PCOS, right from the menstrual complaints to the skin complaints. The patient may present with irregular menses or oligomenorrhea, with secondary amenorrhea, or sometimes even with dysmenorrhea and polymenorrhea. So the investigations basically that we undertake are the sonography scan and the blood investigations. So here we are seeing that the serum insulin level and the What happened to this? Okay, so we are seeing that serum FSH, LH, testosterone, and the insulin. These are the important serological investigations apart from sonography, which help us to diagnose the PCOS. The long-term effects are basically diabetes, hypertension, and malignancy that we are worried about. And related to pregnancy, the patient can have repeated miscarriages. She can present with oligohydramnios or IUGR. So these are some complications which can occur in pregnancy. Now let us see the management. We need to have an integrated approach because this is a modern lifestyle disease. So we need to have a lifestyle modification along with the homeopathic medicine, which will help us in treating PCOS. The lifestyle modification
Dr. Tripti,
includes physical activity, regular exercises, to have a healthy diet, to manage stress, and to also see to it that we are able to manage the psychological stress of the patient. So here, I have conducted a study on 50 patients. So these 50 patients were diagnosed with PCOS using the Rotterdam's criteria. And here, after the diagnosis, we have taken the entire complete homeopathic history. The constitutional remedy was prescribed to the patient, and along with that, folliculinum 30, which is a sarcode, was given to the patient. Now, the role of folliculinum was
Dr.
as a
Tripti, your
specific
screen
remedy,
is not
which is
again.
going to help us to, this was based on the Burnett's theory, where we wanted the patient to take folliculinum regularly. So according to Dr. Burnett, the organ remedies, okay, these are the remedies which are going to stimulate a particular gland. So due to the specificity of the cell or the specificity of these remedies, they will help in stimulation of the follicles and ovaries. So here, folliculinum 30 was given to the patients, and where we had included the patients in the reproductive age group. So from 18 to 40 years were included. The observation that we saw was basically that the age group between 20 to 30 was the most commonest vulnerable age group, and the patients had hair fall and obesity as again one of the common presenting features. Apart from that, the patients, unmarried females, were more prone to develop PCOS rather than the married one. The incidence of infertility was also very high in married females, and 70% of these females had a sedentary lifestyle. So these are some of the modern factors which we have seen to influence PCOS. And apart from that, the constitutional remedy and folliculinum was given, and 94% of the patients found a symptomatic relief, and they did not have to use any adjuvant hormonal therapy. So they were much better with just the homeopathic remedy. The constitutional remedy was given in a single dose, and folliculinum 30 was given repeatedly to the patients. Now, out of the unmarried females who were suffering from infertility, around the patients could 67% of the patients had conceived within 6 to 9 months of the homeopathic treatment. So here, even the infertility was taken care of without the use of any hormones. So we have a much good and better scope over here with the use of sarcode. The limitation of my study is that if we can have a multicentric trial, and if we can have the number of patient size, if that is increased, this will help us to properly evaluate the role of folliculinum and to see whether the sarcode folliculinum is beneficial in the management of PCOS. As per now, in my study, I have found it to be very much helpful. Thank you so much.
Thank you. Do we have any questions for her, ma'am?
Yes, I just want to ask you, Did you conduct any ovarian studies during your study?
I hope I was audible.
Yeah, you were audible. Did you conduct any ovarian studies?
Any questions, please?
Yes. Dr.
Dr. Tripti, Dr. Anu ma'am is asking you a question.
Were you conducting any ovarian studies during your observational study? I think she can't hear me, huh?
I think, ma'am, there is some problem with her connection
Okay,
also.
okay. Never mind, Dr. Anjali. Let's continue. No problems.
I can't hear any one of you.
Ma'am, you can just repeat once, if possible. We can.
Dr. Trupti, what I'm asking is, were you conducting any ovarian studies during your observational study?
Dr. Tripti, can you hear us? Hello? Hello? Ma'am, I think she can't get through.
Let it be. Let us continue.
The next speaker we have is Dr. Shireen Bala. She is working as CMO NFSG with Directorate of Ayush, Government of Institute of Delhi. She will be talking about the usefulness of homeopathic treatment in female infertility. It is an observational case series.
Good morning, respected chairs and all present. Let me share my screen. Is it okay?
Yeah, it is fine.
Is it
you can use the full mode access. It will give a better view.
Okay, okay?
Yeah, this is better.
Okay. Actually, my topic is usefulness of homeopathic treatment in female infertility and observational case series. Infertility is a matter of great concern in this modern era, and around 48 million couples, they live with infertility globally. There are many causes, and one of the causes is recurrent spontaneous abortions. So here I present before you the outcome of 9 cases of spontaneous recurrent abortions that came to my OPD. I work in a homeopathic unit in Lal Bahadur Shastri Hospital, which is a government hospital in Delhi. So the females between 20 and 30 years of age were selected. They complained of repeated spontaneous abortion in the first trimester. So the detailed case was taken, and they were not under any medication. So after detailed case taking, the mentals and physical generals were taken, and they were given constitutional medicine. I had also referred to the Kent's repertory, the chapter on genitalia, female, abortions, second month, third month, early month, and tendency to. The medicines which came up there was Apis, Scipia, Naxomica, Lycopodium. But after individualizing each case, the medicines which came up were Pulsatilla, Natrimur, Naxom, and Scipia. So according to the case, I started each case with the 30th potency. Before treatment, I asked them to get all the tests done, all the normal, the CBC, and none of them were anemic. When the 30th potency was repeated twice a day for a week, and it was followed by the 200 potency. They were followed up every 2 weeks. So the 200 potency was given once a week, 2 doses once a week. Once the patient came up, and when they came up and told me that they have missed their periods, then the urine pregnancy test was done. Before this, the spouse's semen analysis was also done and confirmed to be normal. The follow-up was done every fortnightly, 200 potency, 2 doses a week. Then they were advised to go to the nearby dispensary, and they were given supplements according to the Government of India protocol for ANC, iron, folic acid, and calcium. All the patients were of the low socioeconomic status. I also advise them to have the diet and regimen, green leafy vegetables and whatever seasonal fruits they could have, and also have a glass of milk daily. After 3 months, they consulted the obstetrician in a hospital, and all the tests were done. None of them had hypothyroidism. No one had diabetes, and all the VDRL and CBC all were done and all were normal. The first level ultrasound was also done in the first trimester, and there was no abnormality of the fetus, and everything was normal. They continued, and I followed up the cases for 6 months. Then, though they kept in touch with me, then the pulsatilla were given. The females, they became about six females. They came to me, and they conceived within 2 months of treatment, and 3 in 2 to 4 months of treatment. Pulsatilla was given in 6 cases, Natramur in 1 case, Naxwamika in 1 case, and Cipia in 1 case. The potency is 30, 200, 1 m, and in 1 case, I had given 10 m 1 dose. After all the females, they gave birth to healthy children. Out of these 9 cases, 7 gave birth was normal delivery, and 2 had to undergo cesarean. They had a short stature, and there was cephalopelvic disproportion, so cesarean had to be done. Out of the rest 7 cases of normal delivery, 2 opted for home delivery, and the midwives took care of the childbirth. All the children, all the babies were healthy, and I feel homeopathy has great scope in this field. Research studies can be conducted in this area, which can help infertile couples bring about new life into this world. The happiness of holding a new life in your arms cannot be explained in words. Thank you.
Thank you, Dr. Shireen. Any questions for her, ma'am?
Dr. Shireen?
Yes, ma'am.
Yes, I just want to ask you one question.
Yes.
Were these patients taking hormones also along with your medicines?
No, no other medication. No other medication. Because initially when I took the case itself, I asked them, and they were all very poor patients. They could afford to go to very poor patients.
Right. And did you stick to any phase of the ovulatory cycle when you were giving these medicines? Did you concentrate on that?
The first time they came, just immediately after the menstruation stopped.
Okay.
That day I gave the 200 potency.
Okay.
According to the case.
So it was not on the peak of ovulation that you tried?
No, I didn't take care of that.
Okay. Fine. Good.
Okay, thank you.
All good.
Thank you.
Dr. Kanchan, ma'am, any questions for her? So we go to our next speaker now. Dr. Sampath, he is affiliated with HMAI. He is a private practitioner, and he will be talking about PCOD, irritative female foot, and its treatment in homeopathy. Yes, Dr. Sampath, please go ahead.
Thank you, sir. PCOD, the irritative femalehood, and role of homeopathic medicine. By me, we all know the definition. What is polycystic ovarian syndrome? According to the Rotterdam criteria, the clinical diagnosis of PCOD required that a patient present 2 of the following. We all know. So the time is too short. The polycystic ovarian syndrome, the irritative femalehood, and role of homeopathic medicine. Introduction. We all know what is polycystic ovarian syndrome or what is polycystic ovarian disease. According to the Rotterdam criteria, the clinical diagnosis of PCOS or PCOD required that a patient present 2 of the following symptoms: hyperandrogenism, oligoovulation, or polycystic ovarian syndrome visible in ultrasound. Now, what are the pathophysiology of PCOS? We all know it may be insulin sensitivity, insulin secretion, from insulin secretion, neuroendocrinology, CNS program, or ectopic fat storage, or epithelial changes. Sir, please, I want to scroll down. Thank you, thank you, thank you, thank you, thank you. Sir, please, upwards, please. Thank you. The clinical presentations present in the patients: irregular menstruation, amenorrhea, painful menstruation, obesity, acne, sleep apnea, type 2 diabetes, hair loss, thin hair, abnormal hair growth, deeper voice, husky voice, pelvic pain, anxiety or depression, or infertility. Investigation done by me. Blood for TSH, DHEAS, blood for cholesterol, blood for TSH, blood for testosterone, total and free, blood for cortisol, blood for prolactin, blood sugar, fasting and 2 hours post meal, fasting insulin level, ultrasound, ultrasonography, CT scan, and MRI. CT scan and MRI done for 2 patients only. The objective, the homeopathy, a complementary system of medicine that has successfully used in different disease conditions, including PCOD. Abstract is present to the demonstrations of positive results of the individualistic homeopathic medicine. Now, the method. In the study of 56 female cases of young female patients of age between 15 to 42 years, PCOD with related troubles, they are treated with individual homeopathic medicine. Each case was followed up with clinical and ultrasonography evidences. The homeopathic medicine was chosen on the basis of the patient condition totality. The potency of the medicine was selected as per the homeopathic philosophy. Management is necessary with homeopathic medicine. What is the management? Lowering insulin level, restore regular menstruation, restore fertility, treat autism, eat healthy, and live healthy. Now, so please scroll down. Number of the patient according to the symptom. The symptom present, and there is the percentage of the patient according to the symptoms. And there is a age group also. Age group 15 to 24, 18 patient, 25 to 33, 26 patient, 34 to 42, 12 patient. The medicine prescribed according to the symptomatology. Natramune 30 patient, Calcarea car for 12 patient, Pulsatilla for 10 patient, sulfur for 9 patient, Shapia for 3 patients, Ignatia 3, Platina 2, Soranum 2, Tuberculinum 1, and Lachesis 1. Sulfur is prescribed for each and every one for conclude the treatment. At last, I prescribe sulfur 200 for everyone. Result. Sorry, Natramune or Calcarea carb or Pulsatilla, all medicine are prescribed only for 1 dose. Result. Marked improvement was observed in all cases of PCOD, and 5 of them get baby, that is, recovery their infertility. Conclusion. Since the last past century, PCOD is very common in whole world and every economical group of society. It is a global need for carrying out the evidence-based research Sir, please scroll down, please. To avoid the side effect of the antibiotics or hormonal pills, highlight the effectiveness on the beauty of homeopathic medicine in different disease conditions. Thank you.
Thank you, Dr. Sampath. Any questions for him, ma'am? Any questions for him, ma'am? Dr. Anu, ma'am, Dr. Kanchan, ma'am?
No, we can just proceed.
Okay. Ma'am, he was our last speaker for the day. So I'll request both of you to please give your concluding remarks. Dr. Tripti, is your mic okay? Can you answer the question which Dr. Anu ma'am had asked you? Dr. Tripti? No, ma'am, she is not there. Please give your concluding remarks, ma'am.
A very good afternoon to all of you. This really was a very informative session. I congratulate you all for the commendable work which you have all done. And no doubt, the role of homeopathy is immense in female diseases, in PCOD, endometritis, ovarian cyst, and all these diseases related to females. And again, to sum up, a well begun case, a well done work is almost half done. So the fact that you had already emphasized was that a well taken case, yes, the case taking should be very fine. It has to be very detailed. And I think there is a word to say that you all are doing a great job, but you should also concentrate on the physiology of the diseases, especially when you are taking up cases of infertility. And just like the other system of medicine is concentrating on the ovulation times, for the fertility, I think you should have such studies where you concentrate on the ovulatory phases and you do more of ovarian studies. So that will be more evidence-based and it will bring a greater output, as I feel. Nevertheless, you're doing a great job. And one more thing, please also, we must always concentrate on the investigation part, because when we are dealing with such cases, the patient is from a low socioeconomic, is maybe not going to any other expert. So we should keep tab on all the investigations so that we are able to guide the patient when to go and consult another specialist and when to continue with homeopathy. Thank you very much.
Thank you, ma'am. Dr. Kanchan, ma'am.
Yes. Yes, madam. Thank you.
Ma'am. Yeah.
Thanks all speaker and organizer give me a chance. Liga platform. Dr. Manchanda, Dr. Javarsha, and so many teams, organizers. Thanks. Today's speaker is on topic obstetric and gynae. Very nice topic. And give me a common problem in obstetric gynae. Try to best all speaker to participant. All are good stage for all participant all over the world. Liga. So nice day.
Okay. Thank you, ma'am.
Okay.
may I request you both to please rate these posters as well. And I wish to thank everybody, especially the chairs, for sparing time for this session and giving valuable comments which will help to improvise further. And also a very big thanks to all the panelists. Thank you.